Hello and welcome to this month's Fire Chiefs video message for April 2022. Here we are at Station 32. Pete, thank you for joining me, and spring is here for sure, I'd say.
Well, we've had some transition in the weather, that's for sure, and I think you're right. It seems like the spring weather is finally here.
Yep, and last week marked the 5 years since the untimely passing of Rick Gentilcore in 2017, and a moment to pause and reflect and to think of Rick and his family and all the folks at Station 15. That was a very sad Friday afternoon, a very sad time in 2017.
I think you're right. It's a great time just to take a pause and think about what his contributions were, but certainly the dangers of our job and how important it is to maintain our well-being and health and all that.
And we're going to talk about some enhancements planned with the FY23 budget about health and wellness as well, for sure. Indeed, the abilities to think about Rick's involvement at Wheaton, involvement at 15, started there as a volunteer and was assigned to 15 on day work in 2017. So it's important to look at and after each other, as well as be responsible and look after yourself. So definitely a memory of others who have passed in the service throughout your career, my career, and the career of everybody. We have those people that we think about and those people who we worked alongside that have given a lot to this community, and Rick was one of those.
Yeah, absolutely.
Budget. March 15th, the executive released his proposed 2023 operating budget. Next week, we are starting our first budget hearings. There's a lot of good stuff in the budget. This year's budgets for fire rescue is proposed to be at just over the $250 million mark. A lot of stuff in there. What did you see?
Yeah, well, first of all, it's the county executive suggested it was the largest budget ever. And I know the school system has they received the largest amount ever. So certainly, as you said, it was very positive in that sense. I believe it's close to 8% increase for us in fire rescue. I know that there's a lot of things that you were able to get in, that have been planned and mapped out for a while, but a big focus on wellness, well-being, and certainly EMS.
Yeah, absolutely. And I wanted to start off talking about another acronym. Got to throw another four-letter acronym into this. It's ESPP. That stands for the Emergency Medical Services Transporter Supplemental Payment Program. So that's the ESPP acronym. And that is coming to us. We started that this year, FY22, and we are very grateful for the work done by Maryland Institute of Emergency Medical Services, MEMS, and the Maryland Department of Health, MDH, because it's a combination of MEMS and MDH that put together a supplemental payment plan and amendment to the Center for Medicaid and Medicare Services, or CMS by acronym. So that's a collaboration between those two organizations. Montgomery County, as well as several others across the state, are the recipient of that funding. The best way to describe the ESPP funding is gap funding. So it takes a look at the number of transports we had, the amount of reimbursements that were provided by Medicaid on that, the gap between the reimbursed level and the actual expense level, and then provides us a reimbursement to that. So that is a great opportunity. We are working through the final phases of the FY22 points on that, but the FY23 county budget is working from the base of about $11 million of annual revenue coming in via the ESPP process. And that definitely has been used significantly to base those improvements in fire rescue. So ESPP comes with some allowances or funding allowances, and this screen helps identify that. EMS workforce development and stabilization, capital equipment acquisition and maintenance, augmented evaluation and quality improvement initiatives, and enhanced program development and expansion. So indeed, as we look at what's in the proposed 23 budget, there is a lot that draws direct association to this ESPP.
And Chief, you and I had talked about it a bit, that this comes on the shoulders of our workers, of course. We wouldn't get any of that funding if they hadn't done the transports in the first place. So a lot of good work by our people have allowed us to collect this windfall, I guess, or this reimbursement. So it's been a lot of work, and it's not for naught that there's some things like the supporting the liaison, EMS liaison officer. I forget exactly the fancy name you call it, but EMS 700 that we were used to during the pandemic. So that is a great asset to help manage that. A couple chase cars and some other staffing components.
This slide here shows 7 bullets, and 6 of those 7 are direct EMS level service performance. New chase car aimed for Station 1. And this is a little bit different than the current chase cars. So we're going to implement this one as planned. We'll be adding the chase car at Station 1 and leaving the medic unit at Station 1 as an ALS transport unit. Different than 8 and 25 and what we did at Wheaton. So ALS chase car at Station 1 adds a 3rd EMS duty officer to the 2 that we have. One of my long-term goals has been to have 1 EMS duty officer per battalion. So this is the beginning step of that. And we'll talk a little bit about another tie to that in a second. As you say, the system capacity officer, EMS 700, is right here in the middle of this slide, talking about the capabilities there, and that will be an added full-term service. We did it through the 3 different surges of COVID, but EMS 700 as a full term. MIH, adding 2 additional firefighter paramedic positions to the staff in the MIH and Avital's team at headquarters, providing more staff capacity, visit capacity, and folks to go out with our MIH team and assist with our community interaction. Adding the EMS quality management battalion chief, adding another capability as we look for and continue to improve our level of service and care. ESPP is supporting this. This next to last bullet here, flex staffing, 4th duty officer or chase car, deserves a little bit of extra dialogue. Yeah. We know that I would like to have 5 DOs, so that would be 2 more beyond the 3 that this is coming with. I have been clear that I want to have more chase cars. I've also been clear that I want to aim to have more flex units. So one of the things that this line item gives us is 5 FTEs or 5 recruits in our year worth of hiring to be able to do a part of this in EMS. Where they're going to go, are they going to be the 4th duty officer and be at that officer rank? Don't know. Are they going to be another chase car at Station X? Don't know. Will they be on day work in 2 flex ambulances? Don't know. But we're hiring the bodies. The bodies are approved in this line and part of our recruit class plan for FY23. And as we get through about the 2nd quarter of the year, basically the December-January timeframe, we'll have some additional and up-to-date analytics to use, and we'll make that decision with OMB and the executive as to where to place these 5 bodies. So definitely forward thinking that we know we're going to use them. We've got to get the folks in the recruit training train and in that flow, and where they're going to go, we have time to decide. So that's what this line is. All three of those, duty officer, chase car, and flex units, all are great utilization for and places we need to expand. So that's what this EMS flex staffing is described as and earmarked to be. Station 40, getting 2 additional night and weekend personnel with this request. So today they're at 9 during the day and 6 nights and weekends, with a necessity of at least 3 folks from Sandy Spring LFRD. This will bring them up to 9 and 8. Still needing at least 1 LFRD member to maintain minimum staffing, and still several positions beyond that at 40 for additional LFRD folks. But this is a joint request that Sandy Spring has asked for and is included in the executive's budget.
And you know that that statistically we are getting busy, so all this certainly supports all that. And a lot of the budget is obviously community focused, and the focus, a lot of what we do is EMS related. So
yep.
It fits hand in glove.
So that last slide was all uniformed, firefighter uniformed positions. Now this budget also includes including adding FTEs or full-time professional staff and civilian staffs, program manager at EMS Logistics, a program manager at Small Tools, getting folks there to be permanent duty assignments, enabling people like Captain Poist or Captain Henry to return to their field duty assignment, and having FTEs there, as well as a supply tech at the EMS operations to keep work on and keep up with that focus in the warehouse proper. Talking about warehouses, this budget includes supporting a expansion that we just implemented about a month ago, with increasing warehouse space at Dover Road for Special Ops Tech and the Urban Search and Rescue team, as well as, and this ties into one of our points earlier, a expansion of our mental health team. Right now our mental health team is 2 folks, Dr. Lee and Lori. Doing great work, and they're in separate offices in different parts of the county. This is a program that gives us 2 more people, another therapist, 3/4 time, as well as an administrative member in the office. And it's an office consolidation. They will all be into one building, one site, one workplace, so that they can have that additional teamwork together, but provide us with the goal of more outreach, more education, to do preventative mental health engagement, and to continue the same level of emergency support, as well as treatment of our men and women and their family members. So great expansion of both the team of mental health as well as the office space, including that. So
yeah, we certainly want to make sure that our people have access to all these things to, again, focus on their well-being as we go forward.
So the 23 budget aims for 84 recruits as the number of graduates for the year. So what will be known as RC 51 and RC 52 will be quite large. They will probably start close numbers to nearly 100 over that year as an aim to getting 84 graduates in the year. So work is already started with 51 and 52, and that's moving along nicely. Additionally, the FY23 budget includes almost $4 million, $3.7 million, to provide operational dollars in areas where we've had long-term structural deficits: fleet, facilities, wireless communications, and medical supplies. Areas in which things have gotten more expensive day over day. And we're not even talking about fuel prices. That's a different story. But there's funding in the FY23 that includes the expansion of funding in those arenas, which is definitely appreciated and much needed, as I was at CMF this morning as an example.
Yeah, and that's of course been discussed and there's been a need for quite some time, so the timing couldn't be better. Certainly the budget has been beneficial in that regard.
So we're working through, the BA2 Omicron or the BA2 COVID variant. It is the middle of April now. A lot of stuff is looking up on the COVID front. Everybody still make sure you're working with and keeping your reporting. If you feel sick, contact FROMS. We still have a little bit of uptick. We are at that spring break time, and people are out and about on traveling. This is being filmed right before the Easter weekend as well. So people definitely need to keep attention to, if they're interested in, that extra booster is now available. Wear that PPE on calls. But FY23 budget, like I said, next week we're talking with the Public Safety Committee. And the final budget is not determined until basically the last week of May. Somewhere around the 24th or 25th of May is when the council finishes up their budget. So we got about 45 days before that's done. And we'll know exactly what is in the budget, how this lays out. One of the complicating parts to that slide with all 7 of those bullets is some of those start immediately, like the EMS duty officer. Some of those start once the first recruit class graduates in December, and some of those don't start until the second recruit class graduates, will be basically June, so at the very end of the budget year. So all of that has to be finalized before it's worthy of outlining what's starting when and how that changes takes effect. So a lot of moving parts still ongoing, and people will be updating that as we go through other videos. And
the timing is kind of a typical thing that you go through during these budget cycles typically, but also we need everybody's support. So if they have opportunity, folks out in the community or our members, if they have opportunity to support the budget in those public forums with the council, certainly we encourage everybody to do that.
Right. So they're out there available, YouTube as well as on cable channel 6, and people can watch those and see and understand a part of the process. So a lot of things going on. The opportunity to enjoy the springtime weather, as we always try to talk about. Get out there, enjoy the weather, get out and do that driver's training as well as that area familiarization, and before it gets in hazy hot, the summer weather for the East Coast here. Good times.
Yep, certainly spring cleanup, and as we go forward, we're going to be talking about our river safety initiatives come Memorial next month, Memorial Day, I should say, coming next month. And there's a lot of safety things that we want people to engage with. So engage with the community, as you said. And, getting back to, you mentioned the COVID stuff, there's a lot of other stuff going around too, like allergies and flu and colds and things like that. So certainly we hope everybody will just take care of themselves.
Absolutely, absolutely. And as we are working and limited community engagement activities are definitely back on. Please, take care of looking at the community's needs, helping them as they may want to come visit the station. Have you go out to the nurse, the daycare or the school or community event. By all means, let's keep at that and engage with the folks, because as everybody's coming out of their shell and enjoying the warm weather and 2022. It is very refreshing for sure.
We need our first responders to be first preventers.
Absolutely. So as we wrap up the April video, a lot of things going on, a lot of good stuff on the horizon. Take advantage of the warm weather, get out there, train, review your area, be prepared for the next emergency, as you never know what it will be. And take care. Until next time, be safe.